In this video, I'm going to explain everything you need to know about omeprazole, especially what it does to the body and about specific side effects. This is especially important if you are about to start omeprazole or you're already established on it. I'm also going to answer 3 frequently asked questions in my clinics at the end of this video. Does omeprazole cause vitamin deficiencies? Is there a risk of getting bone fractures? What is the link with stomach cancer? These are really important questions that you should be fully informed about when making a decision about taking any medication. This video will help you to understand more about omeprazole and allow you to make a logical decision about taking it. So let's get started. So what is omeprazole? Omeprazole is a type of medicine called a proton pump inhibitor, PPI. It is most commonly known by its brand name, which is Losec in the United Kingdom and Prilosec in the United States. Omeprazole reduces the amount of acid your stomach makes. It's commonly used to treat indigestion, heartburn, and acid reflux. It's also taken to prevent and treat stomach ulcers. Omeprazole can also be given as part of a triple therapy treatment with 2 other antibiotics to get rid of bacteria called Helicobacter pylori, H. pylori for short. This bug can get into the stomach and cause stomach ulcers. Sometimes omeprazole is also used to protect the stomach from taking certain medications, such as anti-inflammatory drugs like ibuprofen or blood thinner medicines such as warfarin or clopidogrel. So how does it work? Proton pumps are located along the lining of your stomach, and these are responsible for the acid production in the stomach, which helps to digest food. Omeprazole prevents proton pumps working properly, which reduces the amount of acid that the stomach makes. These work differently to other medicines like antacids such as Gaviscon or Tums, which actually neutralize the acid in the stomach. This is different from omeprazole in that omeprazole reduces the amount of acid that's produced in the first place. Who can and cannot take it? Omeprazole can be taken by most adults. To make sure omeprazole is safe for you, tell your healthcare provider if you have ever had an allergic reaction to omeprazole or any other medicine, have liver problems, or are due to have an investigation called an endoscopy, as taking omeprazole can affect this procedure. So how and when do you take omeprazole? Omeprazole comes as capsules, tablets, and as a liquid that you can swallow. Each tablet or capsule contains 10 milligrams, 20 milligrams, or 40 milligrams of omeprazole. The usual dose to treat indigestion is 10 milligrams to 20 milligrams a day. For heartburn and acid reflux, it's 20 milligrams to 40 milligrams a day. For stomach ulcers, it's 20 milligrams to 40 milligrams a day. For H. pylori treatment, omeprazole 20 milligrams is usually given twice a day along with 2 antibiotics. To protect the stomach from certain medicines, it's usually 20 milligrams a day. Now do note that doses are usually lower in people with liver problems. So how do you take it? You'll usually take omeprazole once a day, first thing in the morning. It will not affect your stomach, so you can take it with or without food. One tip is to try and take the medicine 30 to 60 minutes before food, if you can, because then it will be at its most effective. If you take omeprazole twice a day, take 1 dose in the morning and 1 dose in the evening, so try to keep it 12 hours apart. Omeprazole takes about 1 hour for it to start working properly. You should start to feel better within 2 to 3 days, but it may take up to 4 weeks for omeprazole to work fully. So can you drink alcohol with it? It's best to avoid alcohol if possible. Although it does not affect the way omeprazole works, alcohol makes your stomach produce more acid than normal. This can irritate your stomach lining and make your symptoms worse. So how long do you take it for? Depending on your condition or the reason you're taking omeprazole, you may only need it for a few weeks or months. Sometimes you might need to take it for longer, even for many years. But for some people who do not take omeprazole every day, and they may only need to take it if they have symptoms. Once you feel better, often after a few days or weeks, you can stop taking it. But taking omeprazole for a short time to treat symptoms is not suitable for everyone, so do talk to your healthcare provider about what's best for you. So what are the common side effects? These include headaches, feeling sick, being sick, diarrhea, stomach pain, constipation, or flatulence. So what are the serious side effects? Now call your doctor or emergency services if your skin becomes more yellow or your pee becomes darker and you feel more tired. These can be signs of liver problems. If you get joint pain along with a red skin rash, especially on parts of your body exposed to the sun, such as your arms, cheeks, and nose, these can be signs of a rare condition called subacute cutaneous lupus erythematosus. This can happen even if you have been taking omeprazole for a long time. Or severe or persistent diarrhea. This can be a sign of an inflamed bowel or any other serious allergic reaction. So what are the cautions with taking omeprazole with other medicines? Some medicines and omeprazole can affect each other and make it more likely that you'll have side effects or stop one of the medicines working properly. So tell your healthcare provider if you're taking these medicines before you start omeprazole treatment. If you have heart medicines such as digoxin, if you have cilostazol, a medicine that treats peripheral arterial disease, antifungal medicines such as itraconazole, ketoconazole, posaconazole, and voriconazole, methotrexate, a medicine that treats psoriasis and rheumatoid arthritis, HIV medicines, phenytoin, rifampicin, clopidogrel, and warfarin. These are not all the medicines that may not mix well with omeprazole. For a full list, see the leaflet inside your medicine packet. So what are the commonly asked questions? The first question I'm asked is whether there is any vitamin deficiencies with taking omeprazole. This question is related to the long-term side effects, and there are 2 vitamin deficiencies that have been identified. The first one is if you have been taking omeprazole for more than 3 months. It has been shown that the levels of magnesium in your blood may fall. Low magnesium can make you feel tired, confused, dizzy, and cause muscle twitches, shakiness, and an irregular heartbeat. The second vitamin deficiency is if you have been taking omeprazole for more than 1 year, and this has been shown to result in a vitamin B12 deficiency. These will include symptoms of feeling very tired, or sore and red tongue, mouth ulcers, and pins and needles. I will provide all the links to the clinical data below. The second question is related to the risks of bone fractures with long-term use of taking omeprazole. Taking omeprazole for more than a year has been shown to increase your chances of getting bone fractures. PPIs, like most medicines, have side effects, so it's best to take them for the shortest possible time, so ask your healthcare provider for a medication review. I would also like to add that taking omeprazole for over 1 year has also been related to an increased risk of gut infections, especially Clostridium difficile diarrhea infections. This is a serious bacterial infection that can lead people to become hospitalized and become very sick. Doctors don't understand exactly why this happens, but there are some theories that omeprazole changes the natural bacterial flora inside the gut, and this leads to a weaker immune system. So the Clostridium difficile can come and colonize the gut and cause problems such as gut infections. And lastly, I am asked about the link of omeprazole with stomach cancer. There is clinical data now linking taking medicines to reduce stomach acid, increasing the chance of developing stomach cancer. It also is more likely in people taking them for longer than 3 years. It's also important to speak to your doctor if you notice any of these symptoms, which can be signs of a stomach cancer. If you have problems swallowing, if you're feeling or being sick, feeling full very quickly when eating, or losing weight without trying. Now remember, these are not all the side effects of omeprazole. For a full list, see the leaflet inside your medicine packet. So how do you stop taking omeprazole? If you've been taking omeprazole for a long time, stopping suddenly could make your stomach produce a lot more acid and make your symptoms come back, which is called acid rebound. Reducing the dose gradually before stopping completely will prevent this happening. So try taking it on every other day for a few weeks, then reducing the time gap further. Or you could halve the dose by using a lower strength for a few weeks and reduce down slowly this way. Always speak with your healthcare provider if you're unsure how to take it. So what are the lifestyle changes that could help? It may be possible to ease symptoms caused by too much stomach acid by making a few changes to your diet and lifestyle. Start by maintaining a healthy weight by eating healthily. Do not eat foods that can make your symptoms worse, such as rich, spicy and fatty foods, and acidic foods like tomatoes, citrus fruits, salad dressings and fizzy drinks. Cut down on caffeinated drinks such as tea, coffee and cola, as well as alcohol and smoking. Try to stop eating late if you have symptoms at night. Try not to eat for at least 3 hours before you go to bed. And prop your head and shoulders up when you go to bed. This can stop stomach acid coming up while you sleep. Now, if you've enjoyed this video, please remember to hit the like button and hit the subscribe button if you'd like to see new videos that are posted every week. And hit the notification bell if you want to get notified about new videos. And please make a comment in the comment section to tell me what you enjoyed about this video or what topics you'd like to learn more about. You can also check out my other videos on atorvastatin and lisinopril.